Welcome back to Diabetic Foot Files. I'm Dr. G. So let's get into it. So a patient comes in, chronic ulcer, like we always see, weeks, maybe months of not healing. We've done everything, the debridement, the offloading, the antibiotics, and yet it still won't close. And what if I told you the problem was not the wound, it's what's happening at night? While the patient is sleeping, or more accurately, accurately, while they stop breathing. So, what is sleep apnea? A lot of people are actually affected by obstructive sleep apnea, OSA. And so, what happens in sleep apnea? So, the airway collapses during sleep, the breathing repeatedly stops, and oxygen levels drop low. This happens dozens or even hundreds times per night with quite a few people. And each episode of sleep apnea causes hypoxia, which is low oxygen, microarousals, which is pretty much like fragmented sleep, and sympathetic nervous system activation. And the body pretty much never reaches true recovery mode. So, how did they discover the concept of sleep apnea? Sleep apnea wasn't always understood. Early observations, like in the 1800s, 1900s, doctors noticed a pattern: the loud snoring, the obesity, and extreme daytime sleepiness. And this cluster became known as Pickwickiman syndrome, named after the character in the Pickwick Papers by Charles Dickens, which was this overweight boy who constantly fell asleep. I mean, kind of going with sleep narcolepsy, but we're gonna keep with the sleep apnea thing. But Pickwickiman syndrome, that's what they called it at first. And the breakthrough researchers finally identified it as sleep apnea because they noticed that there was a repeated airway collapse during sleep, and that's why they came up with the term obstructive sleep apnea. And the key realization, it wasn't just snoring, because we understand snoring is snoring, but it wasn't just snoring. It was an interrupted breathing, interrupted oxygen, and a systemic damage. So, when it comes to that, what happens to oxygen during sleep apnea? Like I said, it causes hypoxia. So, during apnea, the airflow stops. The airflow, I get tongue tied, forgive me. Airflow stops, oxygen levels drop, carbon dioxide rises. And so, what happens to the brain? The brain starts to panic. There's a trigger arousal, there's an activation of the sympathetic system. And then this cycle pretty much repeats all night. What is the end result? Chronic intermittent hypoxia, oxidative stress, and inflammation. And this is toxic to healing tissue. Now, another thing we always have to remember is oxygen is like a currency for healing. So no oxygen means no healing, which is that's why we love vascular, right? Vascular plays such a huge role in delivering the oxygen through the blood, right? So, oxygen is required for collagen synthesis, fibroblast function, angiogenesis, and immune response. And in diabetic foot ulcers, we know we can have microvascular disease, macrovascular disease, peripheral arterial disease. And now, if you add something like nighttime oxygen deprivation, aka via sleep apnea, that's even double hypoxia. So you have daytime ischemia and you have nighttime apnea, okay? And this could be another reason why some wounds can stall. So let's get into the chemistry of the beautiful oxygen in healing. Like I said, oxygen is like the currency in healing. Oxygen is not just air. Oxygen, it's a reactive molecule essential for life and repair. So the infamous ATP production, which we correlate with energy, right? ATP, inside the mitochondria, oxygen drives oxidative phosphorylation, okay? And that result is ATP production and cellular energy. So no oxygen equals no energy. No energy equals no healing. Now, oxygen is definitely required for collagen synthesis. So, the hydroxylation of proline and lysine, this stabilizes the collagen. And without oxygen, you will form weak collagen and poor wound structure. Now, oxygen is definitely imperative for angiogenesis. So oxygen regulates VEGF, the vascular endothelial growth factor. So, control hypoxia actually stimulates new vessels, but chronic hypoxia like OSA, sleep apnea, damages the system. Now, when it comes to the immune function, neutrophils use oxygen for the respiratory burst. So this produces reactive oxygen species, and we need to go into an episode with that. But reactive oxygen species, ROS, are used to kill bacteria. So no oxygen equals no a weak immune defense. Okay. So when does oxygen become a problem? So it's a nuance. Too little oxygen equals hypoxia and tissue death, right? Too much oxygen, like uncontrolled reactive oxygen species, oxidative damage. So healing requires a balance. So that's why people also do hyperbaric oxygen therapy, which is controlled oxygen increase. But then they have a new thing called the CPAP machine that they use for sleep apnea that prevents oxygen drop. So both help restore the balance. So what is the science linking OSA, obstructive sleep apnea, to ulcers? So research have shown patients with diabetic foot ulcers have higher rates of obstructive sleep apnea. So obstructive sleep apnea is associated with delayed wound healing, increased inflammation, and poor glycemic control. Like we said, intermittent hypoxia, which will repeatedly drop oxygen levels and increase tissue stress, oxidative stress, which will cause a lot of free radical damage, endothelial dysfunction, which will cause poor blood vessel function, and then chronic inflammation, which will be the result will be elevated cytokines. All of these directly impair wound healing. So why does this matter for our diabetic foot ulcers? We already know diabetic foot ulcers already have poor blood flow, neuropathy, and impaired immunity. We already told you how important it is to manage your blood sugar because it literally directly affects your immune function. So if you add in sleep apnea to that, the nightly oxygen deprivation, the increased inflammation, and the impaired collagen is pretty much a perfect storm for non-healing ulcers. So let's talk about the solution, one of the solutions that they do for sleep apnea, which is a CPAP machine. So CPAP stands for continuous positive airway pressure, CPAP. What the CPAP does is it delivers constant air pressure, it keeps the airway open, and it prevents apnea episodes. And the result is a continuous oxygen delivery. It restores your sleep architecture. So the CPAP doesn't just help you breathing, it helps restore your nighttime physiology. So can a sleep CPAP machine be used as a wound healing tool? So the CPAP machine, the continuous positive airway pressure machine, was invented in 1981 by a doctor named Colin Sullivan. And inspired by the need to treat his patients with obstructive sleep apnea without invasive surgery, he did early trials were done with nasal mask and a simple pressure generator, and the breakthrough became them delivering constant airflow to keep the airway open at night. So, how does the CPAP machine work? So, the airflow delivery, the CPAP machine generates pressurized air, and then the air flows through the tube and the nasal or through a full mask. And then there is airway stabilization. So, the constant pressure prevents soft tissue in the throat from collapsing, and this stops the apnea episodes. And then there is a constant oxygen maintenance. So each breath delivers a continuous oxygen to the lungs, and the blood oxygen levels remain stable throughout the night. So, like I said, there is a connection with sleep apnea and healing. By preventing the oxygen drop with the CPAP machine, it reduces the tissue hypoxia, it lowers the inflammation, improves the growth hormone released during deep sleep, and it enhances the immune function. And for diabetic foot ulcers, this means that we have better oxygen delivery to peripheral tissues and also improve collagen synthesis and wound repair. So think of a CPAP machine as a nighttime oxygen stabilizer. It doesn't directly flow to the wound like hyperbaric oxygen therapy, but it does prevent repeated oxygen deprivation that helps give the body a foundation that it needs to heal. So, studies suggest that CPAP therapy can improve oxygenation, can reduce inflammation, and can enhance endothelial function. And in diabetics, a CPAP machine may accelerate wound healing, may reduce ulcer severity, and also may improve tissue perfusion. So you're essentially, turning the night into a healing window instead of a damage cycle if you have sleep apnea. So the nighttime battle, like let's do a comparison with a CPAP machine and without. So without a CPAP machine, if you have sleep apnea, the oxygen levels drop, your heart rate spikes, the cortisol level rises, and healing is stalled. But with a CPAP machine, if you have sleep apnea, the oxygen stabilizes, the deep sleep is achieved, the growth hormones are released, and tissue repair is activated. Okay. So you can see the outcome is completely different with the CPAP machine if you have sleep apnea. And so also, obstructive sleep apnea worsens diabetes because without treatment of a sleep apnea and you're diabetic, your insulin resistance increases and your blood glucose rises. But if you have a CPAP machine that helps address the sleep apnea as you have also diabetes, it helps improve your insulin sensitivity and also it betters your glycemic control. So, and we already know better glucose equals better healing. So, what are some red flags you should never ignore if you're a diabetic patient and you think you might have sleep apnea? If you have loud snoring, if you have daytime fatigue, if you have morning headaches, if you have obesity, if you have a large neck circumference, you should think about sleep apnea and going to your primary care physician, seeing what they think, and they might refer you to a specialist, like a sleep apnea specialist or ENT doctor. Okay, to see if you're ready. They might, refer you for a sleep study or a CPAP evaluation, okay? And this could be a missing piece to help with your wound healing. So, why is the CPAP machine underused in wound care? So, let's be honest. Most wound care, we don't really ask patients about their sleep. We don't screen for sleep apnea. That's not really, our core. I would our specialty, right? But we should, like, I like asking patients how their day were. How are you sleeping? Oh, I didn't sleep that well. Do you snore at night? Okay, you got to ask these questions. And that's another thing we have to ask. We have to treat the patient as a full whole, okay? Because it's not traditionally taught, but that's changing because, it's a whole future. Like I said, there's a whole toolbox when it comes to wound healing. So, sleep assessments and wound clinics might be something to integrate in wound care models in the future, and a CPAP as a part of a wound care protocol. You definitely have to have your primary care doctor to assess the patient if they actually have sleep apnea, but it is quite prevalent in diabetic patients. So I'm just going to reiterate what the research shows. There is a high prevalence of C sleep apnea, I get tongue tied with this one, sleep apnea in patients with diabetic foot ulcers. So, multiple clinical studies have shown obstructive sleep apnea is extremely common in people with diabetic foot ulcers. In one observational cohort, over 90%, over 90% of people with diabetic foot ulcers had some degree of obstructive sleep apnea on a formal sleep study, and moderate to severe sleep apnea was present in more than half of the diabetic patients that they did the sleep study on. And older age and longer duration of the diabetes were independently correlated with the obstructive sleep apnea severity. So, clinical implication, patients with chronic wounds are at high risk group of unrecognized sleep apnea far more than most clinicians anticipated. So there is association between sleep disorder breathing and diabetic foot. So a scoping review pooling multiple observational studies found a possible association between obstructive sleep apnea and both the presence of a diabetic foot ulcer. With formal causal pathways aren't fully proven as yet, the evidence suggests there is a relationship that is consistent enough to warrant clinical attention to it. So sleep apnea may be an under-recognized systemic factor that intersects with diabetic neuropathy, poor glycemic control, and vascular issues, all contributing to the poor outcomes of ulcers. So how can a CPAP machine affect diabetes metabolism? So, although specific large trials linking CPAP directly to a diabetic ulcer healing doesn't exist as yet, there are some studies on CPAP's effect on metabolic control in diabetes. And some research suggests that treating obstructive sleep apnea with a CPAP machine can stabilize blood glucose fluctuations, reduce insulin resistance, improve overall glycemic control in patients with type 2 diabetes, and better overnight oxygenation and sleep quality may reduce systemic inflammation because remember our diabetic foot ulcers are usually stuck in the inflammatory stage of wound healing, which could enhance the healing biology. So although this connection needs more rigorous clinical studies, there is it seems like there's a correlation. But remember, correlation is not causation. Okay, always remember that. So improving your sleep and oxidization with a CPAP machine might improve systemic factors that are critical for wound healing, even if the ulcer specific outcomes haven't been robustly proven as yet. So why does this matter? Matters to us because we care about diabetic feet, right? Diabetic foot file. And diabetic feet problems often have poor glycemic control, peripheral neuropathy, peripheral arterial disease, impaired tissue oxidation, and inflammation and impaired immunity. So obstructive sleep apnea contributes to intermittent hypoxia, increased oxidative stress, systemic inflammation, and worse gly I wanna say glycemic regulation, glucose regulation, all theoretically worsens wound healing. So treating obstructive sleep apnea with a CPAP machine improves the oxygenation and may reduce those systemic stressors, potentially creating a more favorable biological environment for wound healing. Through direct evidence, that is still emerging that it can help with the wound closure. So in the end, a diabetic foot ulcer isn't just a skin problem, isn't just a vascular problem, even though, I say go to vascular first more than anything. Okay, vascular, vascular, vascular isn't just a pressure problem, it's a systemic problem. And, if your patient has sleep apnea or suffocating every night and starving their tissue overnight, the wound doesn't have a chance to heal. It's still stalling. So if the wound cannot heal, that's because it's not oxygenated as well, okay? Because like we said, oxygen is the healing currency. So if your patient's wound isn't it's not just a patch of skin, okay? Like we said, these wounds on the patient's feet and legs or lower extremity, wherever, these are a reflection of what is happening deep inside the body. I keep on telling people that because remember, they say that diabetic foot ulcer is a high correlation with mortality rate, okay? So, while we dress the wounds, we offload the pressure and we fight the infection, there's also a battle that's happening at night when the patient is sleeping. And a battle that most people and most of us never see is, if the patient has sleep apnea, every time your patient's breathing, if it drops in oxygen, if they have a fragmented sleep cycle, because the body's ability to repair, to fight infection, to build collagen is pretty much silenced when they stop breathing and have these intermittent hypoxia events during sleeping secondary to sleep apnea. But a CPAP machine gives the body the chance to keep the airway open, restore oxygen, stabilize the sleep, and let the body do what it was designed to do. And the body is designed to heal. That's that's why I keep on calling it skin gardening. We're moving out the way and letting the body figure it out. Okay, we're moving out the infection, we're moving out the necrotic tissue, the vascular opening the blood vessels so the blood can flow, but your body is the one that heals itself, okay? And so for patients with diabetic foot ulcers, this isn't just about preventing daytime fatigue. This is about turning the night into a healing window for you. It's about supporting every cell in your body so that it can work on the wound while you're sleeping, while you can restore. So when you see a chronic ulcer that refuses to close, also remember sometimes the problem isn't just the foot. Sometimes we might be missing an ingredient, which is oxygen at night. And the CPAP machine may not be the most obvious treatment, but for people with diabetes, the correlation is quite high. They are more likely to have sleep apnea. Patients with sleep apnea, it may be a difference between a wound that heals and a wound that doesn't. Okay. So, sometimes the most powerful healer isn't just in your hands, like that song, Look Mom, No Hands, right? It's in every breath that your patient takes while they're sleeping. So this is diabetic foot files where we don't just treat wounds, we uncover what's really preventing them from healing. And I'm Dr. G, and take care of your feet because they take care of you.